Cardiac questions are some of the most scary questions on NCLEX, but today I am going to simplify everything for you. In this video, I am covering chest pain priorities, the top 5 EKG rhythm you must know, shock types, and nitroglycerin safety. Super easy, beginner friendly, and perfect for quick studying. Hi, I am Gina from Nurse Note Daily, and I post quick nursing tips that make NCLEX simple. Let's start with chest pain, because this shows up all the time. Okay, so when you see chest pain on NCLEX, don't panic and don't jump straight to maths. NCLEX want you to think safety and priority. Here's the correct order. First, assess ABCs, take vitals, and check oxygen saturation. Second, get 12-lead ECG within 10 minutes. This is huge NCLEX favorite. Third, get IV access and labs like troponin. Fourth, give aspirin if patient is not allergic and doesn't have bleeding risk. 5. Nitroglycerin only if blood pressure is safe. And here's the trap. Oxygen is not automatic. NCLEX wants oxygen is if patient is hypoxic, like oxygen saturation is under 90%, or having signs of respiratory distress. If you screenshot one thing today, screenshot this chest pain order. Do EKG in the way that doesn't make you feel overwhelmed. You only need 5 rhythms for NCLEX. Number 1. Normal sinus rhythm. Regular rhythm rate is 60 to 100 and you see P waves. Number 2. Atrial fibrillation, also called AFib. This is irregular and you don't see P waves. NCLEX will test that. AFib has risk of stroke because blood can pool and clot. Number 3. SVT. This is super fast, usually narrow QRS, and the patient might feel palpitation or dizziness. If they are stable, nursing external include vagal maneuvers and adenosines. Number 4. Ventricular fibrillation, VFib. This is chaotic. The patient has no pulse, and this is shockable rhythm. Your action is defibrillation plus CPR. And number 5 is systole. Flatline, no pulse. This is not shockable. You do CPR and give epinephrine per protocol. If you only remember one rule, VFib equals shock, if systole equals no shock. Shock. Shock means poor perfusion. The body is not getting enough blood flow and oxygen. Here are the 5 shock types made easy. The first is hypovolemic shock, means low volume. Think about bleeding, dehydration, vomiting, and diarrhea. Second, cardiogenic shock, which means pump failure. Think MI and heart failure. The fourth is septic shock, which means infection. Early septic shock can look warm and flushed because of vasodilation. The fourth one is anaphylactic shock, which means allergy. Airway swelling and wheezing are big signs. The last one is neurogenic shock, happens with spinal cord injury, and the key difference is low heart rate plus low blood pressure. NCLEX will give you symptoms and ask which shock type it is, or what priority intervention should be. Now, nitroglycerin safety. This is high-yield medication question. Before giving nitro, you must check blood pressure because it can drop blood pressure quickly. Also ask if patient took erectile dysfunction meds like Viagra or Cialis, because together they can cause severe hypotension. A common side effect is a headache. And if the patient still has chest pain after nitro, you need to reassess and notify the provider or rapid response depending on the severity. Okay, quiz time. Pause and answer this. Number 1. Chest pain patient arrives. What is your first action? Number 2. Which rhythm is shockable? VFib or asystole? Number 3. Which shock type has low heart rate and low blood pressure? Drop your answers in the comments and I will reply. Top 5 rhythm simplified, shock type simplified, and we did nitro safety checklist in the end. If you want printable cardiac emergency made easy guide with 25 practice questions, check my Standstill link in the description. And don't forget to like, subscribe, and follow Nurse Note Daily 1 for daily NCLEX help.